Many medical procedures have been put on hold during the COVID-19 lockdown. One of the most delicate of these are abortions. However, Mary Stopes has been conducting abortions through the phone with relevant medication couriered or collected. For more on this, we're joined by Dr. Melusi Dhlamini, who is Director of Clinical Services at Mary Stopes and a contributor of the Bekisisa Center for Health Journalism. Dr. Dhlamini, good evening and thanks for your time. Of course, it sounds quite unusual, but tell us about how you created access, especially to those women who required your services.
Hi, Cassie, and thanks for inviting me. It was a difficult time when the lockdown started. Level 5 was became the mobility of everybody. So it was difficult for our centers. We saw more than half of our clients not coming to our centers. Less than half of clients that we used to actually going through our doors. But obviously, abortion is a time-sensitive service, so we had to think if there are people that need the service and they're not getting it, what is happening to those people? So we had to really think about what we were going to do to innovate and think about whatever else other people in other parts of the world are doing, and basically just copy and implement here and bring the service to the women who need the service during the lockdown. So that's when I think around the time the HPCSA came out and relaxed their guidelines on telemedicine, which were pre-existing. But those guidelines were saying that you can only use telemedicine on clients that you already know. But they came out and said that you can also use telemedicine on clients you haven't met as long as it is safe. So we took that and ran with it, and we actually introduced telemedicine for short-term contraceptive services at Mary Stopes.
Dr. Dhlamini, I imagine that the process could be quite complicated because often the type of procedure that you recommend sometimes determines on how far along somebody is in their pregnancy. So talk to us about the extent to which you were actually able to service everyone and who you weren't able to service.
So according to WHO, you can do telemedicine abortions up to 12 weeks. But what we're doing at Mary Stopes, we're doing up to 9 weeks. Obviously, if you're more than 12 weeks, more than 9 weeks, you can't qualify for the service. The other thing is that what we do is we have an eligibility criteria that you have to pass before you actually get the go-ahead to get the pill or to actually have the pill couriered to you. So there's a few things that obviously you have to. A few criteria you have to meet before you get the service if you ask for it.
Is that service continuing now that lockdown has been eased?
Yeah, definitely. In April, we did about 40-something, that's 40-plus services, and in July, we're doing more than 700. So it's grown quite tremendously, and we've seen that it has helped to actually reach places where we don't have clinics, and it's helping because some of those areas they actually don't have any abortion clinics, and not necessarily Mary Stopes. They don't have any abortion clinics, so we actually are able to reach those kind of places.
Of course, one of the other things that we have to consider here is the psychological support for women who are undergoing this process. How are you able to ensure that those that are coming through for your services are also still able to access whatever psychological support that they may need to help them through the process as well?
The advantage of telemedicine is that you self-manage your abortions. You decide when you're going to do the abortion. You decide who's going to be there. You decide who's going to give you the support. So that puts the power in the person who's going through the abortion to choose who is around them, where they have the abortion, where they were able to actually access support. Obviously, abortion happens for a lot of different reasons, And if one of the reasons is sexual assault, part of the care that you have to provide to the person who you're providing the abortion to is to include counseling services for them. So when there's a need for any psychological support, there is referral networks that we can utilize for those clients.
Dr. Melusi Dhlamini is a medical officer in obstetrics and gynaecology and the director at clinical services at Mary Stopes.